Welcome to the Explainer. Okay, if you're a dental student, the word laser might sound more like something out of a sci-fi movie than your future clinic. Well, we're about to change that. In this Explainer, we are going to completely break down the physics and the real-world use of lasers in periodontics. Think of this as your ultimate study guide to ace your exams and to really get this stuff.
So, what's our game plan? Here it is. We're going to start with the absolute basics. What's the difference between a laser and a plain old light bulb? Then, we'll dive into how a laser's even made. After that, we'll cover its 3 unique superpowers, see what happens when that light actually touches human tissue, and finally, put it all into practice, covering the cool applications and, of course, the super important safety rules.
All right, first things first. Before we can really get what a laser is, we have to compare it to the light we see every single day. So let's really unpack the difference between the, chaotic, messy light that comes from a light bulb and the incredibly organized, powerful energy that comes from a laser.
This slide just says it all, doesn't it? On the left, you've got your standard light bulb. The light it puts out is a total jumble. The waves are messy, they're out of sync, they contain all the colors of the rainbow. It's chaos. But then you look to the right and you see the laser. It's the complete opposite. It's pure, it's organized, it's focused energy.
So the big question is, how do we get from that chaotic light bulb to this perfectly precise laser beam? Well, let's find out. We're going to see how this special kind of light is actually made, right down at the atomic level.
Everything, and I mean everything, starts with this little guy, the photon. It's a single particle of light. Just imagine an electron, right? It gets a jolt of energy, which kicks it up to a higher orbit around the atom. But it's unstable up there. It can't stay. So when it drops back down to its normal spot, it has to release that extra energy. And how does it do that? It spits out a photon. That one little event is the seed for every laser beam in existence.
Now, check out the process on the far right of this diagram. This is the secret sauce. It's a concept from Einstein himself called stimulated emission. It's basically a chain reaction. You have one photon that comes flying in, and it hits an atom that's already excited. But instead of getting absorbed, it actually triggers that atom to release a second photon. And this new photon is an identical twin to the first one. Same energy, same direction, same everything. This is how you start to amplify light.
So where does this all happen? Inside the laser itself. If you look at this diagram, you see the 3 key parts. First, you have a pump source. Think of it like a really powerful flashbulb that zaps a bunch of energy into the atoms in the laser medium. Then you've got 2 mirrors, one at each end. As all those identical photons are being created, these mirrors bounce them back and forth, creating this cascade of stimulated emission. It's like a photon multiplying machine. One of those mirrors isn't fully reflective, so it lets a little bit of that super amplified light escape as one powerful focused laser beam.
So the takeaway here is that this whole unique process, which by the way is what laser stands for, light amplification by stimulated emission of radiation, gives laser light 3 very distinct properties. You can think of them as superpowers, and you absolutely have to know these for your exams, so let's break them down.
Superpower number 1. Lasers are monochromatic. You know how a regular light bulb makes white light, which is really just a mix of every color in the rainbow? Well, a laser doesn't do that. It shoots out light of just one single super-specific wavelength, just one color. And it's this purity that lets us target things so precisely.
Second superpower, it's coherent. Now what does that mean? It means all the light waves are marching in perfect formation. Their peaks and valleys are all lined up perfectly. This is totally different from the jumbled up, out-of-step waves you get from a light bulb, and this coherence is what makes the energy so incredibly concentrated and powerful.
And number 3, the beam is collimated. Think about a flashlight. The farther the beam travels, the more it spreads out and gets weaker, right? A laser beam is the opposite. The light waves travel in a perfectly parallel, tight little beam that basically doesn't spread out at all. This lets you deliver a tiny, precise spot of energy from a distance.
Okay, so let's lock these 3 in, because they are guaranteed to be on your test. Monochromatic, one color. Coherent, all the waves are in perfect sync. And collimated, it's a tight, parallel beam. These 3 superpowers aren't just cool physics concepts. They're literally the reason a laser is so precise and effective in the clinic.
Okay, so we've got this special, super-powered light. But what happens when you actually point at a person? Let's look at how these superpowers actually translate into specific actions when that beam of light hits human tissue.
The absolute key to any laser procedure is understanding this term, the chromophore. This is simply the target, It's the specific molecule inside the tissue that a particular laser is designed to hit. And different lasers have different targets. For example, some laser wavelengths are soaked up by hemoglobin and melanin. That's the stuff that gives blood and tissue its color. While other lasers are really good at targeting water. Choosing the right laser is all about matching its specific wavelength to the right target chromophore.
So when that laser beam hits the tissue, 4 things can happen. Some of the light might just bounce off the surface. That's reflection. Some might pass right through it. That's transmission. Some might get scattered around inside. But the one we really care about, the one that does all the work, is absorption. This is when that target chromophore grabs the laser's energy, turns it into heat, and gives us the clinical effect we want, like precisely cutting or vaporizing tissue.
And here we go. This is the payoff. This is where all that physics gets connected to the real-world stuff you're going to be tested on and, one day, use in your own practice. So let's look at what these lasers can actually do.
That incredible precision makes lasers fantastic tools for soft tissue surgery. We're talking about things like gingivectomies, where you're reshaping the gums, or even removing pigmentation. But one of the biggest advantages is the bactericidal effect. The laser literally sterilizes the area as it works. And what does that mean for your patient? Well, it often means less pain after the procedure and faster healing than you'd get with a traditional scalpel.
And this picture shows you exactly what we're talking about. You can see the whole process right here. The before picture, the laser in action precisely reshaping the gum tissue, and then that clean, beautiful, healed final result. That is what happens when you match the right laser to the right chromophore. It's controlled, it's predictable, and it's incredibly effective.
All right, to wrap this up and really master this topic, we cannot forget about the risks. A laser is a seriously powerful tool. It's not like picking up a scalpel. And knowing the safety rules inside and out is absolutely non-negotiable for anyone who ever plans to use one.
And here's the fine print you have to know. First off, these machines are expensive. But more importantly, there are real safety issues. That perfectly straight beam can bounce off a shiny dental mirror and cause accidental damage to tissue you didn't mean to hit, or even worse, to someone's eyes. That is why everyone, the patient, the dentist, the assistant, anyone in the room has to be wearing special protective eyewear rated for that specific laser. And finally, when a laser vaporizes tissue, it creates this smoke, or plume, that can contain hazardous material. So you need high-speed suction right there to capture it.
So, as we finish up this study guide, let's just think about the big picture here. On one hand, the laser gives us incredible precision and real benefits for our patients. But on the other, it's expensive, and it demands strict, unwavering attention to safety. So the question for you, as the next generation of dentists, is this: how are you going to balance those amazing benefits against the costs and the risks? That's what will really shape the future of lasers in patient care, and that's a decision you'll be making in your own practice.